Hi everyone, I'm Jin Su. Happy to see you again. In this unit, we will study the nursing process. Nursing process is a systematic, rational method of planning and providing individualized nursing care. First, in this session, we will focus on critical thinking in nursing, because critical thinking is an essential competency for nurses to start their clinical practice. By the end of the session, you will be able to describe the definition of critical thinking and clinical reasoning in nursing, explain the 10 habits of the mind and 7 skills of critical thinking in nursing, describe the techniques of critical thinking. Nurses use critical thinking and clinical reasoning skills when making decisions about patient care. For example, when a nurse faces an elderly patient with high fever and dehydration, she must quickly decide the care priority and make plans accordingly. In nursing, critical thinking is the process of intentional, high-level thinking to define a patient's problem, examine the evidence-based practice in caring for the patient, and make choices in the delivery of care. Like critical thinking, clinical reasoning is the cognitive process that uses thinking strategies such as clarifying, questioning to gather and analyze patient information, evaluate the relevance of the information, the relation between the information, cause-result, effect factors, and to decide on possible nursing actions to improve the client's physiological and psychosocial outcomes. Nursing clinical reasoning can be seen as the application of critical thinking to the clinical situation. Briefly, critical thinking and clinical reasoning are the mental process nurses use to make sure they are doing the most appropriate thinking and decision-making. In 2000, Schaeffer and Rubenfeld conducted an excellent study in which internationally diverse expert nurses from 9 countries defined 10 habits of the mind and 7 skills of critical thinking in nursing. The 10 effective components are confidence, based on nurses' their knowledge and experience; contextual perspective, consideration of the whole situation including relationships, background, and environment relevant to some happening; creativity, intellectual inventiveness used to generate, discover, or restructure ideas, imagining alternatives. For example, the nurse in an ICU designed a cotton nest for the infants in the baby incubator to make a hug-like feeling for them. Flexibility, capacity to adapt, accommodate, modify, or change thoughts, ideas, and behaviors. Inquisitiveness, an eagerness to know by seeking knowledge and understanding through observation and thoughtful questioning in order to explore possibility and alternatives. Intellectual integrity, process of seeking the truth through sincere, honest means, even if the results are contrary to one's assumptions and beliefs. Intuition, insightful sense of knowing without conscious use of reason. open-mindedness, a viewpoint characterized by being receptive to divergent views and sensitive to one's biases. Perseverance, pursuit of a cause with determination to overcome obstacles and reflection. Contemplating of one's assumptions and thinking for the deeper understanding and self-evaluation. The 7 skills are analyzing, applying standards, discriminating, information seeking, logical reasoning, predicting, and transforming knowledge. First, analyzing means separating or breaking a whole into parts to discover their nature, functions, and relationships, such as analysis of cultural factors of smoking. Applying standards means judging according to established personal, professional, or social rules or criteria. For example, a nurse judges the effect of pain management according to the clinical guideline. Discriminating means recognizing differences and similarities among things or situations and classify carefully into categories or ranks. Information seeking means searching for evidence, facts, or knowledge by identifying relevant sources and gathering objective, subjective, historical, and current data from those sources. Logical reasoning means drawing inferences or conclusions that are supported or justified by evidence. For example, my rationale for conducting hand hygiene before touching patients is to prevent infection. Predicting means envisioning a plan and its consequences. For example, after systematic health education, patients with diabetes will be able to manage their diet effectively. Transforming knowledge means changing or converting the condition, nature, form, or function of concepts in context. For example, based on relevant knowledge and evidence, nurses create a safety environment for elderly patients to decrease the risk of fall. In addition to the 10 effective and 7 cognitive components of critical thinking, nurses use other techniques to ensure effective problem solving and decision making. These techniques include critical analysis, for which you may use method of Socratic question to ask questions layer by layer. That is, questions about the question. For example, a patient complained of back pain. The question about this problem can be, when did the pain manifest? What was the pain level? How could the pain be relieved? And so on. Inductive reasoning may help you to make a standard nursing diagnosis according to a set of assessment data of the patient. For example, a nurse observes a patient with dry skin, poor turgor, sunky eyes, and dark amber urine, and she determines the patient is dehydrated because she knows the typical manifestation of dehydration. Deductive reasoning can help make a premise according to the general mechanism. For example, a nurse might start with a premise that most of Chinese children love Monkey King. Thus, if the nurse is trying to encourage a child to be brave before a vaccine injection, she may use Monkey King story. Differentiating facts from opinions, evaluating the credibility of information sources are also important steps in critical thinking. nurses must verify the accuracy of information by checking other documents or with other informants. To comprehend a patient situation clearly, the nurse and the patient must agree on the meaning of terms, especially for the medical terms. For example, the meaning of depression may have different understanding by the nurse and patient. Recognizing patients' assumptions also help nurse to provide appropriate care to patients. Understanding the patient's health belief and their culture context can help nurse make a care plan that is acceptable to the patient. In conclusion, nurses should think critically and make sensible judgments and ensure the patient will receive the best nursing care possible. Critical thinking is not a simple step-by-step linear process, but a process acquired through experience, responsibility, and an active curiosity toward learning. In this session, we discussed what critical thinking is in nursing and the importance of critical thinking mind, skills, and technique for nurses. Thank you for joining us. Goodbye. See you next time.